Hello there. So this session I've entitled Pilates for Low Back Pain. And this session I've aimed at folk who have been going a little bit mad during their lockdown, doing too much homework, housework, DIY, gardening, or doing exercises that they found online that they thought was a great idea, but things they haven't done before, and it's resulted in low back pain. Please be very careful when you're choosing an online workout, especially one that's performed by a very young, beautiful, skinny, fit person. That is not you, especially now with the lockdown when we're not doing much exercise. And please don't kid yourself. You won't be able to do it without hurting yourself. You've got to build up your exercise gradually and improving your flexibility all at the same time. So please be really, really careful. If you have fallen out of your loft hatch, if you've fallen out of a tree, doing some pruning or anything else, or lifting something heavy and hurt your back, so you've ended up with severe back pain, with leg pain, numbness or weakness or pins and needles, and you've got new bladder problems as well, you must consult a doctor or go to A&E 111 or have a video call with your GP or with a physio. That's no substitute for your doctor though. You must speak to your doctor because you've probably done something quite serious. If your pain is stopping your muscles working properly, if you're finding it difficult to put your shoes on, if you're generally aching and you don't want to do very much, finding it difficult to bend and so on, you've probably just strained your muscles, probably gone into spasm or irritated some of the joints in your back. In that case, this exercise session is for you. The exercises that we're going to do might look very, very easy, but if you've got back pain, they're not going to be easy. The pain that you experience stops your muscles working properly and stops that internal scaffolding from supporting your spine. So you have to get those deep muscles working again. You've got to wake them up, get them moving again, loosen off those joints that have become stiff and sore. It's like lubricating them, like oiling them. Bit of WD-40 in those facet joints in your spine. Gradually you need to build up the movement. Before you do these exercises, I suggest you prepare for it. Put on a hot water bottle, a Wheatie bag, something like that. You can lie down with it underneath the small of your back or sit in a chair with it in the small of your back and leave it on for 10 or 15 minutes. And I would also take a mild painkiller to allow you to move. Paracetamol is the only one that we would recommend with this COVID-19 virus because it doesn't affect your lungs. So take a mild painkiller, paracetamol, warm up your back for 10 or 15 minutes and then start to do the exercises. Along with your heat, I want you to have a look at my session on what you need to know before you start Pilates. So that's one of the first sessions that I've done online here. So if you can have a look at that and learn how to get your deep core muscles working, we're going to center. Most of these exercises that I'm going to show you now, I try and give to most of my clients. So they might be having treatment, they might have hurt their backs the last week or so, and I would give them a lot of these exercises just to do what they can manage to get their muscles and joints moving. You can stop the muscle spasm by making the muscles work properly and by loosening off the joints. If you leave it, the muscle spasm gets worse, the joints get stiffer and more painful, and you get a vicious circle. So the earlier you can start to move, the better. But as I said before, if you've got severe back and leg pain and you're having bladder and bowel issues, please contact your doctor first because you probably need to have a scan or something like that. So if you've just got aches and pains in your back, you're still finding it difficult to move though, it will probably take a week or two to settle down. But if you can do this routine every day, and even some of the exercises several times a day, it's going to help you to recover much faster. Okay, so as I said before, we're going to do the centering. You can do this in any position. It's probably easier to start off in standing. You can do it sitting in a chair if you don't want to, but if you have sore back, you probably don't want to spend much time sitting in a chair. So we'll just talk about that to start with. So I'm going to come and stand up here and stand back here. So in standing, I want you to practice centering. We talked about this in the previous session. So we're going to wake up our deep tummy muscles, which then overflow into the deep back muscles. And we do that by waking up our pelvic floor. So as I said before, you're going to lift up inside as if you're trying to stop a fart. So lift up inside. Bring that sensation forwards like you're trying to stop doing a wee. And you should feel those deep tummy muscles starting to work already. Now you're going to increase that grip a little bit more as if somebody's walking towards you and about to put an ice cube on your belly. So you're going to draw in a little bit more. So that's you waking up those deep tummy muscles, and without you realising it, your deep back muscles will be starting to work already. So if you do nothing else, please just practice centering. So you're lifting up inside, you're drawing your tummy in, and you're holding it. You're not bracing, you're just holding those muscles. They're working, but they're not bracing. You're not viciously holding it tight. You're going to keep breathing, and you're going to be able to move. So that you do before any movement. Okay, so the first thing I want you to do, if your back is really sore, just come to a wall, put your arms high up on the wall, and just stay here and take some deep breaths. Deep breath in and blow out. And again, so you're getting air in here and you're making these joints move where your ribs come into your spine. Deep breath in and blow out. And deep breath in and blow out. Now you're going to just stretch one arm up the wall and relax, and the other one up the wall, stretch and relax. And stretch and relax. If your back's really painful, this might be all you want to do, but it's much better than doing nothing. Stretch and stretch. Okay, now if you can, I want you to bend a knee and let go. Bend a knee and let go. So your hands are still and you're just bending one knee, dropping your hip down and bend and bend. Okay, now you're going to just take your hips from side to side. Take the weight onto one foot and then onto the other foot. So your hands are on the wall, you're leaning on the wall, and you're just taking your pelvis from side to side. So you can see that my spine is moving gently from side to side. And that's a really nice way to start moving your back. And then just relax. Okay, so that's a really nice way to start you moving if you've got a really sore back. Okay, so next thing we're going to do is come down onto the floor. Now, if you're in a lot of pain, you might want to hold onto a chair, but we're going to go down through kneeling. We're not going to do the normal Pilates roll down because you will not want to do that if your back is sore. So you want to keep your back nice and tall. If you feel up to it, step forwards and then come down onto a knee. If you're in a lot of pain, you'll want to put your hand on something, onto a chair or something, step forwards, and then keep your back straight, keep nice and upright, and come onto your knees. Okay, so we're on the floor and we're going to come now onto all fours. Okay, so the first thing we're going to do is come onto all fours. Now remember we practiced that centering when we were standing just now, so we're going to do it here as well. So you're going to do the lift the pelvic floor, so you're stopping a fart, and then you're going to pull your tummy in, and you should feel your tummy lift up and away from the floor, and then just let it go floppy. Let everything hang out. Then you're going to do that again. So pelvic floor lift, and then pull your tummy up and away from the ground. Hold, and relax and let go. And one more. Pull pelvic floor in, lift your tummy up, hold, and then just let go. Okay, now we're going to do a gentle cat. You won't want to move very far. You certainly won't want to arch. So you're going to grip your tummy and tuck under gently, just a little bit, and then come back to neutral. We are not arching. If you've irritated joints in your back, it's going to be really sore, so don't even think about it. Pull your tummy in and tuck your tail under just a little bit, don't go mad. So you're stretching these muscles in here that are trying to go into spasm, and then flatten your back, don't arch. Then you do that again. So pelvic floor lift, tummy in, and then tuck under just a little bit to stretch those back muscles. and then relax. Now keep your tummy drawing in and just take your hips from side to side. So side to side gently. Your back is still, you're not going to be doing anything nasty with it. Your body weight is going through your hands and through your knees. So it'll be easier to move in this position. Okay, now you're going to wake up some of the muscles in your back and your bottom because they will be switching off. So all you're going to do is slide your leg back behind and then bring it in. Other one, slide back and blow and come back in. So you're pulling your tummy in the whole time. Stretch back and blow. Come back in. Stretch back and blow. And come back in. Now this time you're going to try and lift it a little bit off the floor. Just an inch will do. And then come back in. Stretch back. Blow. Tiny lift up. And then bring it back in again. And stretch. Blow and lift. Bring it back in, and again stretch, little lift, and come back in. If you're recovering, if you've had back pain for a couple of weeks and you're feeling much better, you can do a little bit more movement, but if it's really sore, just do this, okay? If you want to, you can do opposite arm and leg, just a small lift to make all your back muscles work, stretching and lifting, just a small lift. Okay, you're going to gradually build it up. So stretching and a little lift and come back down again. So you're not going mad, you're going to take your time. Now we're going to do that thread the needle because I love thread the needle. And we're only going to do a small range of movement. A hand and just stretch a little bit, bend your elbow a wee bit and come back. So you're gradually going to build this up as your back pain eases. So you're stretching those tight muscles in your back doing this. And loosening off those joints. Okay, so you're pulling your tummy in, blow, and come back, blow, and come back, blow, and come back, blow, and come back. Okay, now we're going to have a wee stretch and a rest. So knees apart, feet together. Take your bottom backwards onto the heels and then stretch your arms and put your head down. So you're stretching out and take a deep breath in and out. Now you should be feeling a good stretch all the way down your back. Just relax into this stretch and breathe. As I said before, the ribs come into the spine here, up here, and they often give you back pain. So if you strained that area, then this is great. But if you can get all those muscles working, stretching and moving, is going to ease your back pain. So both arms are forwards. Take a deep breath in and blow out. Now you're going to take both hands to the left a little bit and put your head down. Same again, deep breath in and out. So you're getting a stretch all down your right side. Deep breath in and out. One more deep breath in. And come back to the middle. Other side, to the right side, both arms, and stay here. Deep breath in and blow. Deep breath in and blow. I try and do everything in threes. Deep breath in and hold it. And then blow, and then bring your arms back to the front again. So really lovely stretch to help your back. Now bring your hands in. If you feel up to it and your muscles are tight in your lower back and you want a bit more stretch, you can do what we call a shell. So you bring your knees a bit closer together now, okay? And then you put your arms by your sides and you drop your head down and you hang. Put your head on the floor if you're able to. Otherwise you can put your head on a pillow or something. I've got a lovely overboard. I love these things. You can rest here if you want to. Put your head on a pillow and stretch. So now you'll feel even more stretch in those tight muscles in here. So muscle spasm makes this go tight. They pull on the other joints, pull on everything and get you sorer and sorer. So that needs a good stretch out. Okay, so arms by your sides and you're staying here and you're breathing now. Deep breath in and blow out. So you'll feel
deep breathing going on into this part of your rib cage. Deep breath in and blow out. Well done. Okay.
If that's uncomfortable, obviously just don't do it. I don't want anything to aggravate you. Okay, now we're going to do an exercise that's going to get those deep tummy muscles working. So this again, you're not doing any stress on your back. Once you've done what we've just been practicing, you should have loosened up a bit and you should manage this. You're going to tuck your toes underneath you, your shoulders are over your hands, you're keeping your back absolutely still, you're gripping your tummy, and then you're going to blow out and lift your knees a wee bit, just an inch or two off the floor and then down. It's harder than it looks. So you should be feeling all the muscles in your corset working all the way around. So if you can, have a little go at this. If you don't lift your knees off the ground at all, you just get pressure through your hands, that's fine. So tummy in, pelvic floor lift, blow out, tiny lift, and lower down. So your back's not moving at all. Pelvic floor lift, tummy in, and blow as you lift. And lower down. Okay, so we're going to come onto our side now. So what I'm going to do is come around to face the front, and then I'm going to do a side sitting. Okay, now whenever you've got a sore back, I want you to go down onto the floor or onto your bed and up again by going through the side lying position. If you come straight up, you're going to really stress that back and the discs in your spine. So always you go down through side lying. Okay, so I'm coming down onto my side here. You can do this too. If you want to, you can get a pillow, folded towel, anything like that, and just lie on your side. Okay, now your knees are bent and your feet and knees are together, and all you're going to do is try and lengthen the side of your waist here. Okay, so you're going to lift the waist away from the ground and push your top hip away from you. I'm going to keep my hand on my hip so you can see what's happening. So if I sink my waist down to the floor, my hip comes up, and then if I push my hip away and lift my waist, it comes away. So a couple of exercises like that is a nice thing to do. Hip away from you and down. Now you can do it with a straight leg. So stretch your leg and then just push your hip away. So your leg stretches away and then relax. Push away, blow. Lengthen that leg and then let it relax. Lengthen your leg and let it relax. One more. Lengthen your leg and let it relax. Okay, bend your knee. Okay, we're just going to move the leg forwards and back a little bit now. So you're keeping that waist off the floor, you're pulling your tummy in and you're lifting that bent leg. And down, and lift, and down. So there's very little else going on. Your back is absolutely still. Blow as you lift, and down. Blow as you lift, and down. One more, up. Now you're just going to move it forwards and back. So lift, take it forwards a little bit, keep the knee bent and back a little bit. So you're straightening through the front of the hip a bit, forwards and back. So hopefully this will it'll make you realise you can move. It'll stop you being scared of moving so much. It'll wake up your muscles and it'll help to stop muscle spasm. And it'll also help to get those joints moving, get them to oil themselves and get them to be less painful. So we're forwards and backwards. And then we're putting it down. If you're recovering and you're feeling reasonably okay, you can straighten out that leg and you can lift it up and down. Remember to keep your waist off the floor so that you're working the muscles down both sides at the same time. Up and then come back in again. Because those glutes need to work too. The muscles of your pelvis are all interlinked with your trunk, interlinked with your shoulders. So working the shoulders and working the hips is going to help to get those muscles working in your back. Okay, so we'll do the same on the other side in a minute, but I want to go through lying on your back first of all. Now, if your back is really sore, I'm going to be using one of these overballs. Now, I love these. All my patients with back pain or recurrent problems have one of these, and I use them a lot in my classes. They're fantastic. These ones are from the APPI. They're a lovely size. You can make them as squishy or as hard as you want. You can get various sizes, but these are a particularly nice size and quite nice and firm. So if your back is sore, I'm going to get you to put your pelvis on it. You can put it behind your bottom and then roll onto it if your back's really sore. If your back's not too bad, you can roll onto your back first of all. And then you can lift your bottom up and put it underneath your pelvis. Okay, so if you're not too bad, you can lift your bottom up and put it under, or say if it's sore, just roll onto it from side lying. So this squashy ball is under your bottom. It's not under the small of your back. If you don't have one of these, you can steal one of the footballs of your kids, just deflate it a little bit, or you could use a hot water bottle. So your hips and knees are a little bit apart, and put your hands on your hip bones here so you can feel what's happening with your pelvis. All you're going to do is rock your hips from side to side. So you're going to lift this hip bone up towards the ceiling and then let it drop. And then lift this hip bone up towards the ceiling and then let it drop. Just a tiny movement is fine. If your back's really sore, just a tiny movement is fine. So you're lifting this hip bone up to the ceiling and then you're lifting this hip bone up. So you're just rocking on the ball. All your weight is sinking into the ball. You're not trying to lift off the ball at all. And you're just twisting your hips, one up and down, other one up and down. So you're just rocking your hips from side to side. Okay, and then come back to the middle. And now we're going to do a little pelvic tilt. Now, as I said before, if you arch your back, it's going to be very sore. So you're going to just tuck your tail under a little bit and pull your tummy muscles in. Let your lower back drop to the floor and you'll feel a little bit of a stretch in that lower back, and then come back to neutral. So you're tucking under and back to neutral. Tucking under and back to neutral. Now don't force this, just do as much as you feel comfortable. You can do this on a nice warm hot water bottle, it'll feel lovely. I'll just move my arm out of the way so you can see. Tuck under and relax, and tuck under and relax. Don't try and arch, it'll be too sore. Now you're going to take your hips from side to side. So you're just rolling the ball from side to side on your mat. You're not going to manage to do this on a hot water bottle, unfortunately. But on a ball, you'll manage it. So side to side. But this is something that we did on all fours as well. So this is a really nice way of loosening off your back. Especially so if you've been doing a bit too much gardening or something and it's sore. So this is your over ball. Okay, now this will give you a bit of support so you can do some of your other exercises. So grip your tummy and you can just lift a leg and put it down. Blow as you lift. So this is first level in scissors. Blow as you lift and lower down. So you're gripping your tummy, blow as you lift and down. So the hot water bottle underneath here, or the ball, is giving you a bit of support, making you feel a bit more confident to have a go. Now if you feel up to it, you can stretch your leg forwards, bend in and put it down and lift, stretch forwards, come in and put it down, and do a few like that. So you're gripping your tummy, you're blowing as you're stretching, so you're getting your muscles working but you're not moving your back. It's getting nice support, and especially if you've got your back on a nice warm hot water bottle. Make sure you don't burn yourself though, won't you? I've seen a few of those in my time. Stretch, come back in and down and lift and stretch, come back in and down. And if you're feeling okay, you could stretch, lower the straight leg a little bit and lift. Don't drop it down very much, just a little bit will do, and lift and stretch. You're not trying to touch the floor, you're not even going to be horizontal, just drop a little bit and come back in again. Okay, we just do these things gently and lower down. You're trying to get your confidence back, you're trying to get those muscles back, you're not trying to force it, just nice and gentle. Last one, come back in, and now you're going to get rid of your ball. Okay, so as I said before, if your back's sore, just roll onto your side and get rid of it like that, or you can lift your bottom up and take it out. So you're going to pop it there. So now when you're on your back here, we're going to try and do that exercise without the ball now. You've had a little practice, so you know what you're doing. Grip your tummy, hands on the floor, blow as you lift and down. So you should feel a bit happier to have a go at this now, and you're just making those tummy muscles work a little bit more. And remember, when they're working, they're also working the whole corset and waking up the muscles that are supporting that painful back. Okay, so lift and down. Then you can try the lift and stretch and down. Remember, if you take your leg up a bit higher, it's going to be easier. So if you're feeling really worried, you can stretch your leg higher. But if you've got a bit more confidence, you can stretch your leg a bit lower. One more, reach forwards, blow, and put it down. So now we're going to do some hip twisting. So you're going to grip your tummy. I've got my knees and feet together here, hands are on the floor, and I'm just going to take my knees a little bit to the right and back to the middle, and then a little bit to the left. Try and keep your knees and feet close together so they're glued together. They're moving as one unit. And then you're going to start waking up those tummy muscles. So as you come back, you're going to blow out and bring your legs back and take your legs to the right side. Grip your tummy and blow as you come back. So you're making those muscles work a bit more. And as you practice, you take your legs one way and you head the other side. Back to the middle, legs to the right, head to the left. Come back to the middle. And legs to the left, head to the right. Blow as you come back. Legs right, head left. Blow as you come back. Legs left, head right. Grip your tummy and blow as you come back. So the slower you do this, the better. If you get a bit more confidence, you can go a bit further and do it slower. Grip your tummy and blow as you come back. So you're not using any momentum at all. It's pure trunk work that you're using. As the pain subsides, you should find it easier to do a bigger movement. And then if you want a stretch, you can take your legs over. But I think it'll be a while before that happens. Grip your tummy and come back. So that's more of a stretch. Take your legs right across. You can put your knee on the ground, only if you feel happy with it. Lift that hip forwards a bit more and grip your tummy and come back. So nice and slowly. Knees together, head the opposite side, knees on the floor and stretch. So this hip goes forwards a bit more and then blow out as you grip your tummy and bring your legs back to the centre. Okay, that's great. Now we're going to do a hamstring stretch. If you're feeling a bit unsure, you might want to use some sort of a strap or a towel. This is a yoga strap. So I would hug your knee into your chest and then put the strap around your foot if you want to, and then hold it up here. If you don't have one of these, you could put a scarf around your foot, or you could use a bit of TheraBand or a belt, towel, anything at all, or you could just pull on your leg. I'm quite bendy, so I need some extra stretch, but if your back's sore, you might only be able to get your leg to there. But if you can stretch out your hamstrings, it will help. The interconnection between all the muscles down your leg and up your back to the top of your head will help your lower back ease off a bit more. So if you can pull on a strap, bring your leg back, then it's going to ease your lower back. Okay, so we're just pulling and holding and breathing. You need to hold this stretch for about a minute, relax into it and just breathe. Okay, now you want to do pointing and bending the ankle, because sometimes you have nerves that are a bit tethered in your back, so you want to loosen that nerve off. So you're going to point and bend and point and bend. So what you're doing here is making the nerve move through the muscles and through all the soft tissue in your back. Point. So that's basically the sciatic nerve you're stretching there. Okay, and you can also do a little bend, straighten, bend, straighten. So if you've got something to pull on, it might give you a bit more confidence to have a little go. Stretch, bend, stretch, and then ankle, so point and bend and point and bend again, point and bend, and then bend your leg in. Okay, now I would hug both legs into your chest and have a little rock from side to side. If you really don't want to, that's fine. You can just do one leg at a time. So you can keep this leg on the ground and put the band around your foot. Or if you can't reach your foot, if it's too sore, then obviously just hold your thigh. So here, if you want to, you can throw a scarf around your foot, or you can just hold on your thigh. Okay, I'll keep this leg bent. So you're pulling in here and hold it for about a minute yet again. And then you're going to do some pointing and bending. So you're going to point your toe and bend your ankle, and point your toe and bend your ankle, and point your toe and bend your ankle, and point your toe and bend your ankle. Okay, now you can bend your knee and straighten your knee. Sometimes you get a bit of pins and needles doing this. And bend and straighten, and then again point and bend and point and bend. One more point and bend, and then bring it back in. Okay, take the strap or the scarf or whatever off. Pull that knee into your chest. If you want to, if you can, hug both knees, and then you can rock from side to side. Now, I think a glute stretch is a great thing to do as well, because you get tight muscles in your bottom often, especially if you've been doing a lot of bending, if you've been doing a lot of gardening in particular. So stretch your glute this way, I would. Put your foot on here, and then you can, if you want to, pull your other thigh in. So your right foot is on your left knee and pull your thigh in. If that's too uncomfortable, then you can just hold this leg and pull it in towards you. So your right hand is on the side of your knee, your left hand is holding your ankle, and you're pulling your leg in and across. So you're trying to get your knee towards your left shoulder, and you're holding that stretch. And you should be feeling a good stretch around here. And if you've got a lot of muscle spasm in that area and in your lower back, that will help to ease that off as well. So after you've done that, again, hold the stretch for about a minute, breathe and relax into the stretch, and then do the same on the other side. So bring that leg in, put it on that knee. If you want to, hold this thigh and pull it in. If you don't want to do that, hold your leg and just pull it in and across. So you're pulling your knee up and across towards this shoulder. Again, just do what you feel comfortable with, don't force it. After you've held the stretch for a good half a minute to a minute, it'll all start to stretch out and ease off. And then after you've done all those stretches, hug your knees into your chest again and a little rock. Now you've got to get up off the floor, haven't you? So, as I said before, I want you to roll onto your side. Don't even think about coming straight up again. You're going to roll over onto your side. So if your back's really sore, I would put your hand down on the ground and then just roll over in a big lump. That's what we do with people that have just had back surgery as well. So you're in good company, you're in a lot of pain. So you've rolled onto your side with your legs bent. And then you're going to put your hand down and you're going to come up onto your elbow, come up into sitting. Okay, and then come onto all fours. So you're on all fours. And then from here, come up into kneeling. So come back here, come up onto all fours, and then bring a leg through. Now, if you need to lean on the chair, either in front of you or at the side, or get somebody nice to help you up. But otherwise, if you're not too bad, you can put your hand on your knee, tuck this toe underneath you, and come up that way and stand. Okay, so all you're going to do now is stretch your arms up above your head and relax. And again, deep breath in. I'm bending my knees because you can't see me. And relax. Okay, well done. Hopefully that's helped you. Try some of those exercises. I'm going to squat down here. Try some of those exercises and see how you get on. Lots of heat, pain, gentle painkillers, paracetamol, something like that, or if your doctor's prescribed you something stronger, then use that. You need to move and you need to ease that pain off to allow you to move. But if in doubt, contact your doctor and get some help. Okay, best of luck with all that. Any questions, you can email me or speak to your doctor or your physio. Okay, best of luck with all all that. Speak to you again soon.